So I wanted to share with you something that I oftentimes do with people that I'm coaching prior to a knee replacement. So let's say your range of motion is good, your strength is adequate, as good as it's going to be, and you're still looking for other things that you can do to prepare for a knee replacement. One of those is working on your sleep training, getting yourself in a good routine, limiting alcohol before sleep, just so your body's in a consistent routine, help you get to bed on time after your surgery. Maybe even trying to sleep in some of the positions that you're going to need to be sleeping in. So, sleeping on your back with your leg elevated, doing that a couple nights before the procedure just to get yourself used to it so it's not such a new, novel thing that you're doing. You're going to have so much going on that's already new. Having a little bit of familiarity with sleeping on your back may help you out. Lastly, going the supplement route, I recommend to everyone magnesium glycinate and melatonin. Two fantastic supplements. I always recommend you try them before your surgery so you know if they work or not. Again, you're going to have so much going on that's already new. You're going to want to know if these supplements tend to help you out. So, trying some of these things. This is lower down in the ladder. If your strength is good, range of motion is good, worry about those first and foremost. But working on getting your sleep hygiene and some other things in order can help the recovery process.